Hey guys, it's Joanne. So the purpose of today's video is to do some Q&A type of Q&A. I can't talk and I just started 3 seconds ago. Q&A non-clinical type of questions, things you might see on the boards, things you should know. I prepared maybe about 40 or so or more questions. Some of them, these are not all, this is not everything that you need to know, but this is some. This is a good beginning for you. So I'll ask you some questions and then you're going to answer it in your head, and then I'll give a little bit rationale behind it for some I'll just skip through it, just so you're prepared and you know what type of questions to expect and topics, okay? Before I get started, I cannot emphasize enough for you guys to know your levels of evidence, okay? What's the highest, what's the lowest, systematic reviews, meta-analysis, all that fun stuff, okay? So make sure you guys know this. I have a YouTube video that explains it without a cheat sheet. Again, know this. Okay, but let's get started. All right, so let me ask you this question. And I'm homesick today, so don't mind me how I sound. And my brain's a little slow too. So anyway, so let me ask you the first question. Which conceptual model states that individuals are motivated to take positive action because they want to avoid negative consequences? Health consequences, obviously, we're talking about. Is this A, medical home model, or is this B, health belief model? Well, if you said health belief model, you were correct, right? So that patient, that person, they want to change. So further bad stuff doesn't happen to them, right? Health-wise. So for example, a patient with an MI, post-MI, might want to make a change. They want to make a positive health action, right? They might start eating better, exercising, all that fun stuff. So further stuff doesn't happen to them, like they don't get another MI, right? Okay, a great thing that goes with health belief model is motivational interviewing. Okay, those two kind of go hand in hand. So remember that. Good to use on like a young person, when we're talking to a 16-year-old who doesn't wear their seatbelt or is not using condoms or things like that. Okay, so health belief model and motivational interviewing kind of go together. All right. So this is just a slide that goes with it. Oh, all right. Let me ask you this question. Okay. Let me ask you this. So a 52-year-old female comes in to see you, and she had an MI. And you, as the NP, you want to start a rehab for her, right? So you want to begin rehab. What example of level of prevention is this? Is this primary, secondary, or tertiary? Tertiary. I can never say it. Well, if you said tertiary, hopefully you guys are laughing at me, with me, not at me. Either way, I don't care. So that's what it is. So these are the type of preventive kind of questions you will have. So make sure you guys know all this primary, secondary stuff, okay? So tertiary is treatment, right? So after the disease occurred, prevention of further disease progression, okay? So just remember the T for treatment, basically. And then everything else just is in my head. All right, let me ask you this. A 17-year-old daughter takes care of all her younger siblings, okay? She takes care of all her little ones because her dad died a long time ago and her mom is a drug addict. So she's kind of put in that motherly position. So she steps up and takes over to take care of the siblings. What theory is this? What example of what theory is this? Is this family system theory? Is this the Kotter 8-step change model? Or is this the telehealth model? Well, hopefully you said that this is the family system theory, right? So basically, family depends on each other. If one part fails or is dysfunctional, everyone is affected, right? But usually someone else steps in and takes over, like the daughter in this example, because her mom is a drug addict or alcoholic or whatever I said, okay? So family system theory, know this. All right, Let me ask you this. Patient comes in, young patient, and you have to talk to her about recent CT results, okay? The results and the prognosis are not good. They're just not good. And you as the new NP, you're very uncomfortable to talk to her about this. And but either way, you decide that you need to be truthful and honest, because that's part of our one of our ethical principles. So what ethical principle is this when you're truthful and honest? Is it justice or is it veracity? Right? I hope you said veracity, right? That has to do with truth and honesty. It's our duty to present information honestly at all times, no matter what the background situation is, okay? So you guys know your ethical principles, and they'll be given to you in an example like that. Veracity. All right. Let me ask you this. Which of the following is federally and state funded? Is it Medicaid or is it Medicare? Well, hopefully you said Medicaid, okay? Medicaid is both federally and state funded, right? It's a government insurance for low income people. So it's the aid for the people who can't afford it, right? And things like WIC falls under Medicaid because it's state, right? By the state. So things like maternal and infant programs like WIC, okay? And so you might have questions that ask you about if patient lives in one state and is moving, what would they do? Make sure you educate them that one state coverage is different from another state. Okay, so they need to reapply again because it's Medicaid is state funded. All right, and then Medicare, right? That's the A, B, C, and D, and that's all federally funded. Okay, so that's a little bit different. And speaking about Medicare, Medicare criteria, right? You have to be over 65 years old and you've paid premiums. It's federally funded, or you could be at any age and have end-stage renal disease or have some kind of other severe disability, okay, no matter of what your income is. Those are some of the criteria for Medicare. All right, let me ask you this question. Sorry, you guys, I'm sick, so hopefully I'm making sense and I'm not very happy. I'm not very upbeat right now. All right, so let me ask you this. Which of the following covers inpatient hospitalization, stays, end-stage renal disease, SNFs, home health care, and hospice? Is it Medicare A, B, C, or D? Well, hopefully you said A, right? A is the one that covers all that fun stuff I just named. Okay, which of the following covers outpatient visits, lab tests, medical equipment, second opinions, and outpatient dialysis? Well, hopefully you're thinking Medicare Part B, right? B has to do with outpatient insurance, okay? So know your major differences between Medicaid and Medicare. I always remember that Medicare, we care for the old. Aid, we provide aid for the poor, okay? All right, let me ask you this. What is it called when an MD sees a patient first, evaluates them, evaluates the patient, then formulates a plan, and then the NP sees the patient for the same problem and uses MD's NPI number to bill at 100%. What is that called? Is it A, Billing Act of 1999, or is it B, Incidence to Billing? Well, hopefully you said Incidence to Billing, okay? That's what it is. So basically, if an MD sees the patient first, checks them out, puts a plan in the chart, formulates the plan, evaluates them, all that fun stuff, then us as NPs can go see that patient and use that MD's NPI and bill them at insurance at 100%, as long as the MD is in the building. Okay. So, like I said, as long as the MD is in the building. So yes, we can use MD's NPI for the same problem if the MD is in the building. But if we see that patient for a new problem, we can only bill them at 85%. Okay. Sorry, my dogs are barking. All right, let me ask you this. What is the mortality rate for infants? Well, if you told me that it's, come on, go next. My slides. Number of deaths in less than 12-month-old per 1,000 live births, you are correct. Okay, so this is just a fact you got to memorize. Correct. Now let me ask you this. An 85-year-old is choosing to have high-risk surgery, okay? And what type of ethical principle is this? Would that be autonomy? Would that be justice? Or would that be beneficence? Well, hopefully you said autonomy, right? Because that patient has the right to make their own decisions, no matter what the risk factors are. It's our job to tell them all the risk factors and so forth, but autonomy. So know all your ethical principles, right? Justice has to do with fairness. We treat everybody the same. And beneficence has to do with to do good, okay? All right, so let me ask you this. So a patient calls you up and they tell you that they no longer can make their appointments, they no longer come see you in the office, they live in a rural area, and they can't drive, and they have macular degeneration. What do you recommend for them to do? Would you A, send an ambulance for them to pick them up to make it to their appointments, or B, would you refer them to telehealth? Well, hopefully you said telehealth, right? Telehealth. So basically anyone who lives in a rural area, is bedbound, disabled, like the person with the eye issue can qualify for this, right? Basically telehealth decreases overall costs and increases access to healthcare. So know your telehealth. Tell me which act, which happens to be the first act, allows us to bill Medicare. Is it the Balanced Budget Act or is it the Budget Reconciliation Act? Well, hopefully you said the Budget Reconciliation Act, the BRA, okay? That's the first one that allowed us to bill Medicare, okay? So just facts you got to remember. Tell me which act allows us to bill at 85% and the NPI number is required. Is it the Budget Reconciliation Act or is it the Balanced Budget Act? Well, hopefully you said the BBA, okay, the Balanced Budget Act. That's the one that allows us to bill at 85% and we need that NPI number to do so, okay? Those two go together. Okay, so Medicare will only reimburse NPs at 85% of what of fees what are normally provided by the MD, right? Such a bull when the MDs get 100%. Okay, terrible. All right, let me ask you this: what is a collaborative relationship? What is a collaborative relationship? So, right, so a collaborative relationship is basically a formal, I think of it as a formal relationship, right? So that's when like you as an NP, an endo, an ortho. Sorry. Oh my goodness, I'll never get through this video with my dogs barking. Sorry about that. Anyway, so basically all of those work together for the benefit of the patient, right? They all share the responsibility. So now let me ask you, what is a consultant relationship? Well, if you said it's an informal relationship, you're correct, right? So that's basically you as a new NP call me up and you're like, hey, Joanne, I need some advice, some recommendation on this patient, okay? And you don't need a consent from the patient to tell me, as long as you're not giving me names or whatever. You just want some advice, but I'm not really involved in their care, okay? So that's the difference. So quite often a few questions pop up on both of these. All right, let me ask you this. Which agency allows NPs to obtain registration number for prescribing controlled medications? Is it the State Board of Nursing? Is it the State Practice Act? Or is it the Drug Enforcement Agency? If you said the Drug Enforcement Agency, the DA, you're correct, okay? That's who allows you to prescribe the goodies, okay? All right. What is an NPI number? The National Provider Number. Is it a 10-digit number which is used to bill Medicare, Medicaid, and it's covered under the Balanced Budget Act? Or is it B, the 10-digit number that identifies the diagnosis of each disease? What is the NPI? Well, hopefully you said A. The National Provider Number is that 10-digit number which is used to bill Medicare, Medicaid, and it goes together with the BBA, the Balanced Budget Act. Those two go together, right? The other one that B option, that's an ICD-10 code, okay? So you have to know that as well. So each of us, once you pass your boards, you're going to apply for your NPI number once you get your license and all that fun stuff, so you can bill for your services. All right. Which culture uses herbal remedies or supplements or whatever you want to call it? They use it a lot. They avoid eye contact because of respect. They avoid loud volume, and the belief that health is from living in harmony. Well, are those Europeans? Are those Native Americans? Or those Hispanics? I bet you a lot of you guys answered Asians, right? Because that's what people tend to say. But Native Americans is the answer to that, okay? Native Americans. So the avoiding of eye contact is also very common in Asian population as well, okay? But Native Americans. All right, let me ask you this. Which of the following should you avoid prescribing Excedrin to? In which of the following cultures should you, or religions, or whatever you want to call it, should you avoid prescribing Excedrin to? A, Hispanics, B, Orthodox Jewish, or C, Seventh-day Adventist? Well, hopefully you said Seventh-day Adventists. Is that how you say it? Right? Because though that population does no caffeine, no alcohol, no pork. They also celebrate Sabbath, and Excedrin has caffeine in it, okay? So be ready for these type of questions. Okay, which of the following cultures should you provide a modified physical exam for? Perhaps the patient chooses to wear their clothing when you perform an exam. Would it be a Muslim woman? Would it be a European? Or would it be a Hispanic? A Muslim, right? I mean, not that you wouldn't offer that to others if they don't feel comfortable, but culturally it is it's acceptable for a Muslim woman to stay covered, and the man often is in the room as well, her husband, during the exam, okay? So know your different cultures. All right. So now a 42-year-old homeless patient with no insurance comes in to see you. Or maybe they come to the ER and they have back pain and this patient's triaged. And you treat this patient the same way as everyone else. What ethical principle is this? Is this justice or is this fidelity? Well, hopefully you said justice, right? Because justice is to treat everybody fairly and equally, okay? And fidelity has to do with loyalty, dedication, keeping a promise, okay? So know your ethical principles. Okay, let me ask you this question. An NP provides a teenager with written information about seatbelt use. What level prevention would this be? Would this be primary or secondary? Well, hopefully you said primary, right? Because primary is we want to prevent the disease or prevent an injury before it actually occurs, right? So that's primary. Immunizations are primary. It's the most cost-effective way to prevent disease, okay? And secondary, I just remember screening. So screenings, right? So we screen for disease early. Okay. What type of leader is known as an adaptive, flexible, changes roles depending on the situation, and steps up when necessary, when needed to? Is it a democratic leader or is it a situational leader? Well, hopefully you said a situational leader, right? That's the one that changes, adjusts, adapts in whenever needed to. All right, let me ask you this. You're obtaining a pap smear and a lipid panel is an example of which level of prevention. Is it primary or secondary? Well, hopefully you said secondary, right? Screening. Those are type of screenings, early identification of a disease. So that would be secondary. I had quite a bit of these type of questions on the exam. This, like I said earlier. All right. What is risk management? Is it A, it focuses on safety, or is it B, focuses on productivity? Well, I hope you said that it focuses on safety, okay? So risk management, it's basically focuses on safety. It identifies and decreases risky events to minimize adverse patient outcomes, okay? So risk management looks at areas like medication errors or hospital-acquired infections, patient identifiers, falls, things like that, okay? So it's important to know the definition and identify those examples. All right, let me ask you this. Do you know the 5 stages of change? I should have put this on the slide, but I didn't. Okay, so if you do not, the 5 stages of change, I just remember it as PCP and AM, okay? PCP, AM. So pre-contemplation, contemplation, preparation, action, maintenance, and relapse, okay? So the stage 1, pre-contemplation, basically, right, so stage 1, the pre-contemplation, wow, how did the writing get here? An example of that is basically a patient would say, like, if you tell me to quit drinking one more time, okay, so they're not ready, they're not interested, they don't care, okay, that's just the beginning. Okay, stage 2 is the contemplation. So an example is like the patient might be like, I want to quit smoking, right? So now this patient is considering change. They look at the positives, the negatives. They kind of feel stuck. They're kind of in between, like, oh, what do I do? Okay. Then the 3rd stage is preparation, right? So this patient might be like, okay, I found a AA meeting, okay? So now they're ready to maybe change their behavior and thoughts, but they're not quite yet not there. So we have to kind of push them, all right? Then the 4th stage is action, all right? So the patient might say, I quit drinking 3 months ago, all right? So they're ready to go forward. They take good concrete steps, okay? But not consistently. They're still not solid, okay? So again, we want to encourage them, praise them, and positivity, and really reinforce them. And then finally, the 5th stage is the maintenance or relapse stage, okay? This is when the patient tells you, I'm avoiding bars, okay? So basically, they're learning to continue change and embrace their habits. And you're just going to continue to reinforce reinforce them, okay? So these are the 5 stages of change. Oh, that was a long question. All right, let me ask you this. A new NP, you, soon to be, has a new patient who needs stitches, okay? The NP has never done this, and for safety of the patient, does not want to perform the task. What ethical principle is this? Well, hopefully you said non-maleficence, okay? Non-maleficence, right? Do not harm, okay? Obligation to avoid harm, protecting patient from harm. Again, know your ethical principles. Okay, let me ask you this. What is validity? Is it an appropriate results or is it accuracy of results? Well, you hopefully you said it's accuracy of the results, okay? So the results indicate what the researcher thinks they should indicate, okay? That's about validity. And it could be internal and external, and that's a whole other explanation I should probably make a separate video for. All right, what is reliability? Reliability is the consistency of the results, right? Results are repeatable, okay? Like over and over and over, they can be repeated. That's reliability. What is clinical decision support? What is clinical decision support? Well, is it a system which allows us to charge faster and more efficient? Or is it a way for health information to guide our practice so we minimize errors, which uses variety of tools such as alerts and reminders and help us with decision making? Or in other words, systematic approach to guide our decisions. Well, hopefully you said B, right? That sounded more complicated. So know the definition of clinical decision support. So, okay, so one example of this is, let's say you're prescribing amoxicillin or something like that to your patient, but the patient has a penicillin allergy and you didn't realize that. So you put your order in and you're like, and then it flashes at you. You cannot prescribe this because the patient has a penicillin allergy, okay? So that's an example of it. To minimize an error, okay? It will not allow us to order it so we don't make that mistake, okay? Or another example, like an order set. We see those as RNs, right? For example, you admit a patient for CHF and you can have a whole order set to prompt us what to order, what labs, meds, and so forth, follow up. All right, what is incidence? Incidence. Well, if you said that it's the number of people who contract the disease or the new cases of the disease, you were correct, okay? So know the definition of this. What about prevalence? What is prevalence? Well, if you said it's the number of people who are living with the disease, the existing disease, you were correct as well, okay? Question. Which minor can consent for his own care? Is it a 14-year-old in foster care? Is it a 16-year-old complaining of a headache to the school nurse? Or is it C, emancipated minor? Well, hopefully you said the emancipated minor, right? And that emancipated minor is someone who's married, someone who's in the military, and it's appointed by the court that they're emancipated, right? Okay. What is CPT, or current procedure terminology? Is it A, a list of identified codes that can be used to identify procedures and services, or is it B, a list of identified codes for diagnoses? Well, hopefully you said A, and it's the list of identified codes that can be used for identifying procedures and services, right? And for CPT documentation, you must have 3 things, okay? So remember these 3 things. You have to have history, you have to have physical exam, and you have to have the decision or plan, okay? Documented. True or false? ICD codes and CPT codes are used for billing and documentation. That is true, okay? You need ICP codes and CPT codes for billing and documentation. All right. I'm just going to ask you a few random questions. How can an NP promote health herself and manage healthcare organization? How can an NP promote herself and manage care organizations? A, join professional organizations to overcome challenges and barriers, or B, FNP already is acknowledged as a PCP, so we don't care. Well, hopefully you said join professional organizations to overcome challenges and barriers, okay? So expect these type of questions. All right, let me ask you this. An NP establishes rehab program for teenagers who have some kind of issues with drugs and alcohol. What type of prevention is this? Primary, secondary, tertiary? The third one, right? The third one. Okay. How can EHR or electronic health record help with patient safety? Is it A, drug-to-drug interactions alert the NP to protect the patient, or B, it doesn't protect the patient? A, right? Drug-to-drug interactions alert the NP to protect the patient, okay? I feel like I'm missing a page. I wanted to discuss something. It's coming. All right. So next question. You want to make a change in your organization and you want to get the attention of nurses and social workers and educators and whoever else. And what would be the best way to do this? What would be the best way to present the research to that variety of groups? Would it be A, show them a PowerPoint, or B, present the research in multiple types of presentations? B, right? Present the research in multiple types of presentations. So it reaches the most of your audience, okay? So some of the questions on the boards will be kind of common sense too. So just read them carefully and don't get thrown off when you see a non-clinical and you're freaking out, okay? All right, let me ask you this. EHR, electronic health record, was passed in 2009. It was due to which of the following acts? Was it A, high-tech, or the Health Information Technology for Economic and Clinical Health, or B, Balanced Budget Act? Well, hopefully you said high-tech, right? So this is important for you guys to know. So basically, electronic documentation started here in 2009 with this high-tech thing, okay? And also the CPEOs, the computer physical order entry, happened at the same time. So now everything is legible, right? No more scribbling. You don't know what the heck the doctor wrote. It's all put in electronically. So less errors would happen, okay? And high tech basically said that they're going to provide financial incentives if organizations or providers demonstrate meaningful use, okay? And then they would be penalized if they don't, up to, I think, 2015, and then it was extended or whatever date it was, okay? And then meaningful use, I really can't talk, is the utilization of the CDS, right? The clinical decision support. So those are those decisions guides that help us prevent further errors, okay? Decisions that guides us to prevent errors, right? And we kind of talked about that earlier. I kind of think about it as a clinical, as a tool, like an electronic tool. So for example, the high blood pressure will alert us in red, or like I said earlier, amoxicillin will be entered in the computer and it won't let us order if they have a penicillin allergy, okay? This also, the clinical decision support also is part of getting our patients involved to participate in their care with things like portal sites that, patients are able to log into and obsess over, okay? Hopefully that makes sense. All right, let's move on. A patient comes in to see you and they don't want to use their CPAP machine that night because they think it's going to affect their sex life. Okay, what would you do about that? What would you do? well, hopefully you would get their wife or the girlfriend involved and have a conversation with them as well, to help that patient, okay? That's what you would do. Obviously, as long as it's okay with the patient. How is the NP showing leadership with a patient that has some kind of infectious disease or communicable disease? A, requires siblings to get vaccinated, or B, just ignores it? Well, hopefully you said that it requires siblings to get immunized, right? So if your patient comes in, you'll have a lot of leadership type of questions. So if a patient comes in and they, sorry about that. Sorry, I keep having to stop this video because my dogs don't listen to me at all. So that's another example of what we just talked about. All right, let me ask you this. An NP notices that there are many obese children in her community, okay? How can an NP demonstrate leadership? Can she start an after-school exercise program for these kids? Or should she just yell at the obese children to start exercising? Okay, so that's enough. When you guys keep hearing there's a lot of leadership type of questions, this is what I mean by that, okay? So she would start an after-school exercise program. All right, a couple more questions. And my dogs are barking again. I'm just gonna keep going. What is quality assurance? What is quality assurance? So basically what quality assurance is a system that evaluates and monitors quality of patient care, okay, and facility management, okay? So it could be implemented by audits or utilization reviews or even peer reviews or outcome studies, patient satisfaction, looking at how you're performing as a provider, things like that. So the goal of this is to promote and improve quality of care. Okay, so you got to know the definition of quality assurance. All right, let me ask you this. A Mexican patient is refusing their dialysis, okay? They are refusing their dialysis for whatever reason. What would you do? Would you just accept their decision, or would you talk to his family? Some of you want to just say, okay, you accept whatever, but this is a cultural type of question. So you would want to talk to his family, right? Because a lot of the Mexican culture, Hispanic culture, rely on the family and decision making. So you would want to talk to his family. All right. Okay, and one more, last one. All right, what is relative? I am going. So what is relative risk? Okay, so you gotta know, don't really necessarily have to know how to calculate it, but you definitely need to know the definition of it, right? So it's basically the ratio of probability of an event occurring in an exposed group to the probability of an event occurring in a comparison or non-exposed group, okay? So an example of this, probability of lung cancer in a smoker versus non-smoker is the relative risk, okay? So just know the definition so you're able to recognize it. All right, hopefully this helped a little bit. I'll have more of these sessions. I'm gonna put a whole thing together for everything. I just don't have the time, and since today I was sick, I had the time. Sorry for a million interruptions with my dogs, but I am at home and that's just how it goes. All right, happy studying, you guys. I'll keep this up for 24 hours, then I'm going to delete it. So good night or goodbye.